Hello there guys, welcome back or welcome if you're joining for the first time. In today's video we're looking at the bone marrow and its function in hematopoiesis. Our bone marrow is basically just a factory and its product is cells, blood cells. So the bone marrow is the major site for hematopoiesis. Hematopoiesis being quoted from a Greek word which hemato means blood and poiesis basically means making, so blood making. So if you're having issues with your blood, let's say anemia, the blood are going to be either a central problem, so problem with production of the bone marrow, as seen in aplastic anemia, or a peripheral problem, so destruction and loss of the blood, as seen in hemorrhage and other cases. Now, hematopoiesis didn't originally start in the bone marrow. During the third week of embryologic development, it was started in the yolk sac. Then, by the fourth to fifth week, it moves to the aorta, the gonads, and the metanephros. Then, around the third month of fetal life, it moves to the liver. Then, fourth month started entering into the bones. The stem cells started entering the bones. And by birth, basically, all your bones start producing blood cells. Now, as a tiny, cute little baby, all your bones have hematopoietic stem cells or HSC. But as you grow older, these stem cells start retreating into your exoskeleton. And by age 20, you basically have a 50-50 split. Half of your bones contain red bone marrow, and the other half is yellow bone marrow. Yellow bone marrow has a storage function instead of hematopoietic function. Now let's talk a little bit about the bone, the container holding your bone marrow. Your bone has multiple layers. Now we have the periosteum, the copper bone, the spongy bone, and the medullary cavity. Now note this might not be accurate as I'm using AI to create these images, but the bone does contain all this stuff. By trabeculae, it grows in response to stress on the bone. So basically how you move your body or how you move dictates how your trabeculae grows. So what is different between red and yellow bone marrow? Red bone marrow is hematopoietically active, is highly vascular and contains hemoglobin, and is mainly exoskeleton. For yellow bone marrow, it is energy dense as it stores energy as fat, and as such, it is rich in fat, and it is found in the long bone. Now, for cells present in the bone marrow, only the mature cells are flexible enough to pass through the spaces in the endothelium and enter into the bloodstream. Now, we have hematopoietic stem cells. The way we don't run out of them is because these stem cells produce two daughter cells, and only one starts differentiating into blood cells. And that one that differentiates creates two lineage, myelin lineage and a lymphoid lineage.